Hey, beautiful people. Today, we're talking about one of the most important steps in your social work journey, supervision. Yes, one of my first loves. So if you're preparing to start supervision for your LCSW or your LMSW, this video is going to break down everything you need to know. I'm talking about how to find the right supervisor, what questions to ask, what you can and can't do during supervision, and of course, how much does it cost? How much are you going to pay? What does it look like to get supervision? So before I jump into that, I want to tell you the beginning. Make sure you hit that like button. Make sure you subscribe and drop any questions or comments you have in that section below because your girl reads them all. And I'm going to be back answering them. And also doing a video on it if it's something that pertains and something that you feel like you need more of. Why supervision matters. Yes, why are we doing a whole video on supervision when either you're in it, you've done it, or maybe you're thinking about it, or you've learned a little bit something about it? Trust me, there's some things that are missing and some questions that you still might have. So supervision is where you take all that theory that you learned in your MSW program and you put it into practice. It's required to get your clinical license, and it ensures that you're providing ethical, effective services to your clients. Absolutely. So, I don't have a checklist, but I'll be sure to drop maybe the checklist or maybe the details of supervision requirements for your LCSW, because I know it varies per state. You have to have a certain amount of hours required, types of clients, documentation, all of that stuff. It does differentiate between whatever state you're in and the state that you're trying to get supervision in. So if you have questions about a specific state, please drop it in the comment section. I would be more than happy to kind of elaborate on it. I'm licensed in quite a few states, but obviously not them all. So I can only share with you my expertise in the states that I am licensed, but I'd be more than happy to research and get some information for you if you're struggling with getting information on the state that you're trying to get supervision in. So let's talk about why supervision is required. Typically, you need to get between 2,000 to 4,000 hours. Anywhere between 2 and 4 years you spend getting supervision. And it's required because you want to be able to build your confidence and develop your clinical skills under someone else's license. I kind of like to look at it as your residency in supervision. I know they call that for LPCs and social workers, we call it supervisees in social work, but it's basically your residency. It's your time to learn and perfect certain things within your craft and to get the assistance and the knowledge and the skills needed to enhance certain areas under someone else's license. So it's very, very important, guys, that you spend that time wisely. Now let's talk about how to pick the right supervisor. I mean, not all supervisors are created equal. I mean, I'm not trying to toot my own horn. I think I'm an excellent supervisor, but there are many great supervisors out there. And it's important to know how to pick the right one. It's very crucial because this person is going to guide you and shape you as you grow into a clinician for the next 2 to 4 years. Hell, that's a long time to be with somebody. So you want to make sure that you can connect with this person. You feel comfortable with this person. You want to make sure that you are finding the best fit for you, not me, for you. So you want to look for a supervisor who aligns with your values, your career goals. You want to check their credentials. Make sure that they're licensed and that they have the experience in the area of interest that you want to grow in. Maybe you want to be a traumatologist, so it'd be really good to have a therapist that's a traumatologist or has some experience in drama. Maybe you want to work with children and families. Maybe this is a good thing to check and see that the supervisor has experience in. You also want to ask about their supervision style. Some supervisors are more hands-on, while others are more relaxed. And there's also different supervisory models. So you want to ask them, like, what's their model? What do they do? How do they practice supervision? That's a good question to ask. Ask for testimonials from future, past, present. Well, obviously you got to ask from previous supervisees. You want to ask them, do they have any references? Have they ever been interviewed by other people before? What do they supervisees would say about them? These are things you want to ask. Don't be afraid to interview this person. You're paying for this service. So it's important to find someone who feels like they'll be a good fit for you. Have you ever interviewed potential supervisors, or did you just jump and pick one? Or was it free through your employer and you're like, hey, it's free, baby, it's going to be good. I always tell people to be mindful of that because you get what you pay for. So either way, if it's through an employer and it's free, or if it's someone that you seeked out on your own, make sure you're getting what you need and what you want in your process. So let's talk about how much does this supervision cost. Supervision isn't cheap. I'm not going to lie to you, but it's an investment into your career. So here's what to expect. Typically for individual supervision, people typically pay anywhere from $75 to $150 per session. That's correct. Per hour, per session, pretty much is about a 60-minute session with your supervisor. That's what you would be looking at paying. And then you have group supervision. That's typically anywhere from $30 to about $75 per session. Now remember, some supervisors offer sliding scales. Some of them are open to payment plans. Sometimes you can get reimbursed from your employer. Sometimes there's different state companies and organizations and grants that actually help people offset the cost for supervision. So don't look at that price and that fee and get overwhelmed. There's many ways that you can pay for it. I have had many of my supervisees' employer pay for it because they need them to be a supervisee to do certain things. So they normally take on the cost or pay them a little bit additional or give them a stipend towards what they're paying for supervision. So where there's a will, there's a way. Don't think that it can't happen. Ask. Only thing they can say is no. How much are you willing to pay for supervision? Let us know in the comment section so we can kind of compare. And tell us what you pay for supervision, because a lot of people pay all different types of rates and prices, and maybe you can help your colleagues and other people see what's going on in your state. What to expect during supervision? Remember, supervision is more than just checking a box. It's a time that you will grow, you'll learn, you'll become confident in being a clinician. So you can expect to do case consultations. It's so important that you discuss your cases with your supervisor. You want to focus on the ethics. You want to focus on the diagnoses. You want to focus on the treatment plan. You want to focus on the interventions. We want to make sure as supervisors that you know what you're doing and that you're doing a good job at it. So case consultations and case discussions are paramount in supervision. Skill development, that's another one. Your supervisor is there to help you build skills like risk assessment, documentation, and therapeutic techniques. I'm one of those supervisors that you ask, whatever you ask and you need, I'm going to make sure I'm able to provide it and give it to you or provide you with someone that can. However, a closed mouth does not get fed. So if you don't let me know that you're struggling with documentation at your job, I'm not at your job, so I don't know that. You need to speak and let your supervisors know what you need and know what you want. Feedback. Expect constructive feedback on your work. This is a learning process. The only way you're going to learn is if you're able to get the feedback to understand what it is you need to do and how you need to get better at it. Documentation. Everybody's fave. As a supervisee, you're responsible for keeping track of your hours, ensuring that all your documentation is complete, not only for supervision, but also with your job and working with your clients. Now let's talk about what you just can't do as a supervisee. You cannot provide independent clinical services. You cannot diagnose or treat clients without oversight, meaning your supervisor or someone at your job that is a licensed person. And you cannot advertise yourself as a licensed clinician. You cannot do that, guys. That is being fraudulent. So be mindful of that. If you want to figure out what do you ask a potential supervisor and you're like, hey, I'm interviewing people or I'm thinking about working with this person, here is a quick list of questions you should ask when interviewing a potential supervisor. These are not the only things, but these are a few things that you might want to consider and ask. Number one, what is your supervision style? Yes, every supervisor has a style, and you want to know that. Meeting with them briefly doesn't necessarily give you an idea of how their style will be when they're supervising you. So just ask. How do you provide feedback? That should be another question. You don't want somebody throwing down a hammer and talking to you like you their child, because you're not. You are their supervisee. You're another adult, another professional, and you need to be able to work together and be respectful of one another. So ask them, how do they provide feedback? Another one is, what experience do they have in your area of interest? So not what they do. That's great. You know they're licensed. But what do they have experience doing that will help you in the career path that you plan on going to? Another one is, how do they handle ethical dilemmas? Are they quick to use the code of ethics, or do they process it with other people? Another question might be, what is your fee structure? Like, how do they charge you for supervision, and do they allow you to do payment plans, or do they require everything up front? They give you receipts? Do they provide invoices? Do they, I don't know, Cash App, Venmo? Do they want checks? Do they want cashier checks? I don't know. Just figure out how they expect to be paid so there's no confusion in the process when it's time to pass the money over. Really good information to know. Also, you want to ask them, how do you track my progress towards licensure? Good question. I've never had anybody ask me that, but it's important to know, how are you tracking this individual's progress? Whenever you're finished with supervision, there's a checklist that the board provides, and they want to make sure that this person is competent and clear in certain subject areas, in certain areas. So how is the supervisor tracking that information? Me personally, I take my notes. I'm really in tune with my supervisees. I watch who participates, who doesn't, how they respond to questions and answers. What are they doing in group activities? Are they on the screen, off the screen? Are they always late? Are they showing up on time? Like, I'm looking at everything just to kind of give me a good idea of how this person is going to show up and be as a clinician. Because I'm a firm believer, how you show up in practice is how you show up when it comes to game day. Typically, when you put your best foot forward and you do everything you're supposed to do in the supervision process, and you show up and do what you're supposed to do, normally it's easy for you when you become a clinician and you're not in the presence of your supervisor. They can tell that when you're at work and other places that you pretty much are on your game and you do what you're supposed to do. So definitely ask them how they're tracking your progress, or grading you, or looking at your skill set and all those things. All right, you also want to ask, are there opportunities for group supervision? That is a big piece. Group supervision, to me, is probably one of the best forms. Individual is a must. You got to do that. Pretty much all states require a certain percentage of individual, but they do allow group. And group is, to me, where the learning takes place, where you're able to meet with your peers and connect with them and really learn from one another. Some people are working at all different types of job placements. So if you never worked in hospice before, and you never worked with a client that was on their deathbed and their families, how are you going to better learn that? Through the other persons inside of the group. You can learn how they handle it and get feedback from the supervisor and hear those types of things. Even though you're not in that setting, it'll help you if you ever choose to go in that setting, or if you have questions or someone asks you. You haven't been there firsthand, but you have been around people who have experienced those situations and circumstances. All right, so of course, as you can see, there's lots of questions you can ask your supervisor. I'm not going to stay all day. Those are about 6 or 7 questions. Hopefully that helps out. If it's more questions you want to ask them, or things you can think of, or you're trying to figure out is it appropriate or not, put it in the comment section. I'll be more than happy to help you. But let me wrap this thing up. Before you start supervision, just make sure you know your state's requirements. Keep up with your documentation. Remember, supervision is an investment into yourself and your future career. So it is something that you're going to have to invest not only your money, but your time and your energy in the process. And what's one thing you wish you knew before you started supervision, if you have already started it? Put in the comment section. I'm sure somebody else might want to hear it, or they might feel like it's something that can help them moving forward. If you found this to be helpful, be sure to like, subscribe, share this video with someone starting a supervision journey. And if you're looking for a supervisor, drop a comment or reach out. I'd love to help you find someone, or tell you some platforms that you can easily find someone that you can connect with. I hope this was hella helpful. Until the next one, be blessed. If you're looking for some test prep ideas, make sure you look in the description section. We have an amazing test prep program where we actually do a lot with accountability and group sessions and all that good stuff. Until the next one, be blessed, and I hope you have an amazing day. And make sure you do so on purpose.